Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hi, it's Lucas, and we have our clinical director on with us today, Dr. Kathrina Crystallis. Hello.
Hi, Lucas.
Hi, welcome. Happy New Year to you.
And you, Happy New Year.
And with that in mind, we wanted to discuss dry January today. So the question is, why do people do it?
So good question, Lucas. So first of all, dry January means going alcohol-free basically for the whole month of January. And there's different reasons. Everyone has different reasons. So firstly, some people might just want to kind of have a reset after Christmas if they've been drinking more than they normally do or drinking too much, perhaps. Secondly, it's a good way to kickstart the year, maybe start feeling a little bit healthier, start the year with more energy, that sort of thing. And thirdly, just some people might use it as a way to reset, maybe change their drinking habits and kind of make longer term changes.
Yeah, so I laughed, but I'm actually doing it myself. So yeah, interesting journey, I must say, but it's, yeah, absolutely lots of benefits. And that's one of the things that I would certainly want to find out a little bit more. So what benefits might you notice?
Perfect. So it depends really on how much you normally drink. And again, it will be different from everyone. So there are some physical benefits, for example, more energy, better skin, weight loss perhaps. And one study actually suggested that going alcohol-free for a whole month can lower your blood pressure, it can reduce your diabetes risk, and actually reduce your cholesterol as well. Additionally, you might find that there's some mental health benefits as well. So you might be calmer. Some people also report better sleep as well.
Okay, I'm looking forward to that. And as we leave dry January, because I mean, we're almost halfway through as well. So heading to February, can you remind us of the recommended upper limit of alcohol and what does it look like?
Yeah, definitely. So kind of men and women, they're advised to drink no more than 14 units a week on a regular basis. And so it's exactly the same for men and for women. And the advice is if you do drink as much as 14 units of alcohol, you should spread that to over 3 days or more. So not to drink all the alcohol in one sitting. And just to give kind of an idea of what that looks like, so a small shot, for example, is 1 unit. A small glass of wine is 1.5 units. A large glass of wine, that's 12% wine, is about 3 units. 750 milliliter bottle of wine, again 12%, is 10 units. And a pint of lower strength lager, beer or cider is about 2 units. That's 3.6%, 2 units. Mm-hmm. So overall, the upper limit would be roughly 4 glasses of large wine a week, or perhaps 7 pints of beer, but or a bottle and a half of wine, but no more than that. Then you're exceeding your 14 units.
Okay, yeah, it's really useful. And would you be able to give us some tips for those of us or those individuals that are listening to us who are looking to use the dry January as a way to kickstart better habits with alcohol and drink less in general?
Yeah, definitely. So I think that if you do manage to make changes in dry January, it is beneficial to try and use those changes, as you said, going forward and try and kind of impact on how you drink for the rest of the year, trying to cut down. So firstly, what I would say is just be aware what 14 units looks like and try not to exceed this. So sometimes when we go through this with patients, they're actually surprised when they calculate their weekly alcohol consumption because often it exceeds the 14 units. They're just not aware of that. So figure out what that looks like for you, and that's a good place to start. Secondly, try spreading the drinking over a few days to avoid binge drinking. You can allocate drink-free days, for example, so several days a week when you don't drink, and that will help you overall to reduce the amount that you drink. And you could achieve this by perhaps telling family or friends, if you're planning a night out, that you're planning a drink-free night, and it's perfectly normal to do something like that. Other tips include not drinking on an empty stomach. So having a meal with your alcohol and try and have snacks kind of with your food to avoid drinking all in one go. Avoiding drinking before you go out. So some people might do something called preloading, and it's a very easy way for the alcohol units to stack up that way. Pacing yourself is another good option. So alternating alcoholic drinks with non-alcoholic drinks, or avoid drinking in rounds, because that means you might drink to somebody else's pace. So drink to your own pace and try and add in alternative non-alcoholic drinks. The other thing to do is to try downsizing your drink. So drinking kind of smaller units or smaller glasses of wine, perhaps, and that helps to reduce the amount of alcohol you're drinking. And lastly, opting perhaps for alcohol alternatives, so like non-alcoholic cocktails, for example.
Okay, and then if you actually feel that you're drinking a little bit more than this, or you are actually worried about the amounts you're drinking, what should that individual do?
So firstly, I think just, maybe try and have that conversation with your family or with your friends. But if you find that you can't impact the change yourself, or it's difficult to discuss this with family or friends, then of course, speak to a GP. So speak to one of us, speak to your own GP, speak to your GP at work. Just basically speak to somebody to get the ball rolling and changing your habits.
Yeah, be open and start the conversation. That seems to help quite a lot of times. Absolutely. Well, thank you so much. Lots of tips, lots of valuable data around that as well as when it comes to drinking. So thank you so much for all of that.
Perfect. Thanks, Lucas.
Thank you all for listening, and do tell your friends. And remember this week to put yourself and your health first.